For this section on the gut-brain axis, I have outlined the following teaching and learning objectives. First of all, of course, we always want to start with a survey of the literature so that we have a good understanding of the pathophysiology involved, especially for the conditions that I'm going to focus on, which are listed here. After that, the main focus of any continuing medical education is to change clinical action. So for that reason, of course, I'm going to focus on and discuss and review the evidence base for general interventions and, where appropriate, also very specific interventions. So the task today is actually quite large. I think that teaching and writing is generally pretty difficult. Good and excellent writing and teaching are even more difficult. And that is when we're talking about things that are well understood. So you can imagine the complexity of talking about things that aren't well understood, such as dysbiosis and neuroinflammation, and those, of course, will be the major topics for today. I've certainly done my due diligence in that I've read hundreds of articles on this topic, including essentially all of the major review papers. I'll talk about some of the better papers perhaps later in today's presentation. All of these have been published in leading journals, and not a single one of these articles has included all of the information that I'm going to cover today. As I state towards the bottom, the task of scientists is to discover facts and relationships. The task of intellectuals is to amalgamate all of that information into functional, comprehensible, and impactful models. To understand the role of neuroinflammation in dysbiosis-induced disease, one must first understand neuroinflammation. And then to understand, again, the role of neuroinflammation in dysbiosis-induced disease, one must understand dysbiosis. If you want to connect those two together, then I think we have the opportunity to gain some unique insights into common conditions, such as depression, anxiety, persistent pain, including, of course, fibromyalgia, chronic fatigue syndrome, and also complex regional pain syndrome. I'll talk about all of those today. So this is the second half of the gut-brain presentation. Let's talk about some of the main components of neuroinflammation. This includes the microglia.